54 days since our first case of COVID-19 in Albany County, week 51. So again, it's been a almost long year, and thank you to everyone who's doing the right thing. So we're going to get through this. The light's at the end of the tunnel, and we're almost there. There are no new people to report since yesterday, but we did have one person pass away over the weekend, a woman in her 60s, so my thoughts and prayers go out to the family. Again, it's a difficult time to lose anybody, especially harder in these times, and to say goodbye. So our death toll stands at 352 since the outbreak started. Albany County residents that we lost to COVID-19. And to the 352 families, again, my prayers and condolences go out to you. It's hard. It's been a hard year, and it's harder when you lose somebody. And to the people that are recovering from this, again, it's hard because it's a long road ahead of you. And I watch what my brother's going through and the difficulty, even though you beat it, you get out of the hospital, the lung issues and everything else that you have. It's a long road to recovery. So please, people, be patient with people. And again, we're going to get through this. But as of today, we have 20,562 cases of COVID-19 in Albany County to date. We have 57 positive cases since yesterday, and there were 81 new positives the day before that. So again, our 5-day average is 80.4. Yesterday it was 86. Still continued to be in the right direction. Currently there's 1,511 people under mandatory quarantine. Yesterday that number was 1,498. Of the new positive cases, we now have 17 close contact to a positive case, 3 are healthcare workers, and 37 don't have a clear source of infection. As of today, 64,205 people have now completed quarantine. Of those, 19,951 tested positive for the virus and had recovered. 72 new recoveries since yesterday, which is good. The increase in hospitalizations overnight was 4. 36 people currently hospitalized from the virus. Yesterday that number was 39. We're now at the lowest numbers of residents in hospital since November 13th, and when there were 35 people hospitalized. There are 3 patients currently in the ICU. Yesterday there was 3 patients in the ICU. That number is the lowest we've seen since November 7th, when there was also 3 patients in the ICU. Albany County 7-day average for percent positive is 1.9%. The Capital Region 7-day average is 2%, which is all good news. We're going in the right direction. Overall, the data continues to look strong, but there is no time for us to be lazy. There's no time to get COVID fatigue. Please continue to wear your mask, cough into your arms, clean your hands, stay 6 feet apart, and we'll continue to get through this. So a couple of the other things I want to point out, some of the new things that have opened up is we've been advocating for is the regional food banks and home delivery mail programs. They're now eligible to get the vaccine. That just came out. And public-facing hotel workers are also available now to get the vaccine. And I know people, more and more vaccines coming out here. Dr. Whalen can probably talk better on it than I can. Johnson & Johnson's being delivered from Louisville, Kentucky today. I believe there's 4 million going out, and probably like 5 or 20 million next week. They're talking about that are going to slowly start to get out there, Johnson & Johnson. So as they keep producing more and the other 2 companies keep putting more vaccine out there, there'll come a point when Dr. Whalen and I look forward to that day when we both sit here and go, hey, we need people to get vaccine. We need people to sign up. That's not the case right now. We have the demand. We just don't have the supply, but the supply is getting better and better every week as it goes by. So please be patient, and your time's going to come. For those who want to get the vaccine, please check your eligibility. Please continue to use the state's website and their hotline 1-833-697-4829 and 201 with the United Way. Again, thank you for everything they're doing with the United Way. The other thing is I talked to my counterparts, Steve McLaughlin in Rensselaer County and Rory Foreman, the Schenectady County Manager, and we talked about the Washington Armory opening up and the eligibility for appointments, which is the zip codes 12202, 12206, 12207, 12209, and 12210, which is some in Rensselaer County, Schenectady. How do people get there? There's no real parking, transportation. I know that they have a trolley back and forth So to Pete Gannon's initiative, thank you. We're going to work it out where we can get bus services and car services for people in the respective counties to get them here. So if transportation, please stand tuned for that. I believe Steve McLaughlin will be putting it out and Rory Foreman, but we're going to be doing it in a partnership with them, and I can't thank them enough for the partnership going forward. We want to make it easy. Also, you can use our new pre-registration tool to get people on the list so we can easily contact them when we have the vaccine clinic set up. The pre-registration list is also being used by other providers, as we continue to say, including the state for mass vaccine sites at the Washington Armory. And again, vaccine will actually begin, at the Washington Armory this March 3rd, and will continue to encourage people to pre-register and to use it. Also, you can find our link at albanycounty.com. And please use the red bar across the top, which will take you to the COVID page. And we continue to remind people there's the difference between pre-register and actually signing up for an appointment. As Dr. Whalen said more eloquently than me, we had a lot of people sign up for that, over 25,000. That was last week, and it's probably grown. You got to be patient with us. We knew it was going to be a hit. I just didn't think it was going to be that much of a hit, but it does show the need, not just here in Albany County, but every county across the state of New York, especially the 57 counties upstate, to have a pre-registration tool to make it easy for people not to get online to get vaccine. But please continue to work with us. We also announced over the weekend that we'll be getting vaccine doses delivered to homebound seniors thanks to the partnership with Sheriff Apple. Sheriff Apple, thank you. Always on the forefront doing extraordinary things. So this is going to be a great partnership. In the governor's office, thank you, and dealing with Larry Swartz over the weekend on seniors that can't get out, which I've been advocating for a long time about getting vaccines to them. Unfortunately, we have a lot of people like my sister-in-law and other people that can't get out, and they have caretakers come in every day. So this will be a good initiative, and with Mohawk Ambulance to go out to senior houses, deliver vaccines, which is just great success across the board. So we talked about a variety of stuff. So Dr. Will will talk about the new supplies they're getting, but on top of that, we got more vaccine going to the Sheriff's Department, more vaccine going to other places, and we have a ton of vaccine coming into the county this week, which a lot, in a great partnership. I look forward to working with Schenectady County, Rensselaer. The health department has a lot of great partnerships that Dr. Whalen and her team have set up over the weeks. There's a lot of people out there that need vaccines, so you're going to be hearing a lot more initiatives with the amount of vaccine we have coming in to get it out to the community. But you got to bear with us. It's a lot more than we anticipated, and it's good. It's good. So I want to thank Larry Swartz and his team for believing in us here in Albany County, and to knowing that we can get it out there in a partnership with everybody, because it does take a partnership to get things done. It's not about the egos. It's not about who has the S on their chest. This is about getting shots in people's arms, and every shot we get in someone's arm is closer to us getting back to some type of normalcy. So again, and getting the people that need it. I'm glad to announce all these new initiatives, but I will say this, we still have to address our frontline workers, like Dr. Whalen's team got it because they're out in the front line. I have a lot of workers that are out in the community that are very essential to my operation here in the county, from water purification to our security guards, to our DCYF employees, or to our DSS employees. I could go on, that aren't eligible. So as we make other eligibilities to restaurant workers and Uber drivers and Lyft drivers, please, let's continue to open up to everyone. But I want to remind everyone, you have an obligation to educate yourself, meaning that we're restricted. So and Dr. Whalen can talk about this. She's very restricted, and we are at times, of what we can vaccine and what we can. And that's why when we do 1B and people are like, you got to open up to restaurant workers. No, we're told that we have to get school teachers and firefighters and police, and that's what we have to concentrate. Now with people on underlying health issues opens it up. We couldn't do 65 and above. There comes with a lot of restrictions. It was the same thing when I said on Friday, people need to educate themselves about nursing homes opening up. I know you hear one thing, people hear that magic word, and that's all they care about. I just heard what I want to hear, and I didn't listen to anything else, okay? So please educate yourself, read up on it. We do put it out. It does put us in a bad advantage, because people are like, well, why can't I come there? And we have to explain to them, or they sign up through our pod and they didn't read every reason, and they get through our pod and they get to the control. Let me tell you, I will say this again to the media, please go down and see the operation that Dr. Whalen and her team run. It's very impressive, the amount of people they put through, but the controls they have in place. And when you get to that, and you can talk about this because I went through it, but when you get to that one lady, you might stand in line and you might have beat the system to get on, but they're double checking everything and they will turn you away. And again, we don't want people to have hard feelings, but you will also have to be honest with yourself how you filled that thing out to get to that point. And do people fall through the cracks yet? No, we're not, it's not perfect operation. No one has a perfect operation. But please, educate yourself and we'll get through this, and we'll continue to get through this as we vaccine people. And so the other reason too is that we put together our first PSA on the subject a while back, and I'm happy to say that starting today, we have a second running PSA commercial throughout Albany County area. Dion Lewis, the New York Giants running back and Albany native, was nice enough to help us out with a video to encourage as many people as possible to get vaccinated. The video was put together by local firm marketing, Adam, who did a really nice job. Adam, thank you. Let's take a look at the PSA commercial with Dion Lewis.
I think Albany made me the person I am today. I'm successful because I grew up in Albany. So whenever I get a chance to come back or try to help people, I always try to do that. I'm not the smartest person when it comes to this COVID, but what I do know is that there's experts that study this, and that those are the people that I'm going to listen to. Everybody wants everything to be normal so bad, but they don't want to do what it takes for the world to get back to being normal. I know my mom has gotten the vaccine already, so I know that she's fine from it, and there's nothing but good come out of it.
So again, it's Dion Lewis, who is an Albany native and an icon of the area. He's been such a great partner with me over the last 9 years, and to his mom, to his family, who've been a fabric of the community where they all grew up on 2nd Avenue, Huffman, and to him being an inspiration to people. Thank you, Dion, for what you're doing and continuing to do for the people of Albany County and New York State. So thank you again. But please sign up and get vaccinated. That was the point of the PSA, if you could hear the message, was to encourage people to go and get the vaccine and why it's so important to get the vaccine. But again, speaking of vaccines, we also got some good news starting this Thursday. The state has given the green light to vaccine those over 65 and older, which is great, and that's why we've got more vaccine coming in. Before this, we were only able to do 1B, which we talked about. So again, continue to advocate and open it up. It's getting there. So thank you, thank you, thank you. And to the governor's office, thank you. And again, to Larry Swartz and them. It takes a long time sometimes to move a mountain, but we've gotten there, and we'll continue to move whatever mountain we need to get the vaccine for the people of Albany County. Dr. Whalen.
Good morning. So the good news is that we continue to see cases decrease across the county, and there's a lot of factors for this, not all of which are known. We are seeing people sign up for vaccines, which is good, and as we start to look at the vaccination data, the percentages by zip code of those who have signed up are indicating where we're doing well and where we need to continue to improve. We're following those numbers and plan on continuing to work with community partners on ensuring an equitable vaccination distribution. We are very pleased that this week we did receive an increased allocation for the over 65 population. We will be hosting a pod today and also Thursday, and may be announcing an additional effort in the next day or so as we plan for the supply that we are anticipating. I do want to mention that at this point, most of the population are familiar with the fact that we have so far had 2 vaccine preparations out. These are Moderna and Pfizer. The Moderna vaccine is a 2-dose vaccine that is administered on day 0 and day 28. The Pfizer vaccine is a 2-dose vaccine that is administered on day 0 and day 21. These vaccinations have been available across the Capital District in various amounts, and we're pleased yesterday that the FDA did announce an EUA for an additional vaccine, which is the Johnson & Johnson. vaccine. This is a single-dose regimen, which will be attractive to a lot of people because it is a single-dose regimen. So individuals that may find challenges with getting back for a second vaccine may find this an attractive option. It, like the others, has undergone rigorous clinical trials. It is safe and effective. In terms of the efficacy, we know Moderna and Pfizer are in the 90 percentiles for how the level that they can protect you against severe disease and death. So those are very reassuring numbers. The Johnson & Johnson vaccine in trials in the United States has shown about a 72% efficacy. This is still very strong efficacy. So, I want to reassure the public that as we continue to get vaccine out, as more people are immune to the effects of COVID-19, and that is some people have had the infection and have a variable immunity, and some people have had the vaccine and have immunity. We are looking at, for herd immunity, a level of about 70%. So this is targeting where we want to be. It is still a very effective vaccine. I know we often talk every year about flu vaccines, and for a flu vaccine, 70% would be a pretty good number. So, I do want to reassure the public that this is another very important tool in our armamentarium. And as we start to get supplies of that, we will be pushing them out in the community as well. So this is something we are looking forward to. We are looking forward to continuing to increase our efforts to work with our Medical Reserve Corps and with community partners and with our partners particularly at the hub, which are the hospitals and the local health departments in the capital region, to increase strategies to get vaccine out in the community. So I thank everybody for their, the interest. As the county executive indicated, we do have a large group of people that are pre-registered, and we are working through those lists. We are not the only people that are pulling from those lists. So as vaccine becomes available in pharmacies, in some providers' locations, in various levels, others will be utilizing that list to continue to ensure that we have, we are registering people that might find it difficult to do so on the internet. This is our commitment to you. We will continue to do this work and continue to ensure that we're doing everything possible to get the vaccine out in the capital region.
Dr. Whalen, thank you. And again, thank you to your team. And, just to kind of put the light at the end of the tunnel, you got to think about this. Every time she does a vaccine, they have to come back 4 weeks on one, I believe 28 days, and then 21 for the other. Well, if you vaccinate all through March, that means all through April they're going to be here. If they do it through April, all through May. And I will attest to that her department for the last year, and all of our departments in the county, been working at maximum force. And again, it's going to take a while. And to her and her staff for their dedication, thank you. People get tired, it gets tough out there, and but we continue to need to find solutions to the problems, work for the people, and a partnership to get things done. Again, like I say to everyone, leave the egos at the door. It's not time for that. You want to take a glory lap when it's all over with, great. Dr. Whalen and I need partners, and we need partners in the community to get the vaccine out and testing and everything else. On Friday, we announced the mental health initiative. Again, to OCA, thank you. It's been a long 5 years to get this done. But to the 3rd Judiciary District of the City of Albany, thank you. And again, this is going to be a game changer for a lot of people. Can't thank them enough. I want to remind people, too, please, Whitney Young is not going to be doing testing anymore, because really now we're getting more vaccine. They're going to be turning their operations into more and more getting the vaccine out there. They've been a great partner. They will test individuals one-on-one if you call to make an appointment, but they won't be doing it like we set up. But again, to Whitney Young, thank you for the first partnership and for the continued partnerships going forward, and to Dr. Whalen herself and her team for making it continue on with Whitney Young. Again, that's what it's about, and things are going to change as we go forward. Please use our website, like I said earlier, for appointments and testing times and all that stuff. Our mental health is always available 7 days a week from 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. To Karen Ziegler and the team again, thank you for what you do for a lot of people in the county. It's a difficult time. If you have any concerns or questions, 211, and then New York State hotline, as always, 1-888-364-3065. And again, people, continue to wear your mask, cough into your arm, clean your hands 6 feet apart. We're getting through this, and I'm hoping March, as the weather improves, we just don't loosen up and stop putting our guard down. I can assure you, Dr. Whalen and I do not want to go backwards. These numbers have been great, and I want to thank everyone for doing the right thing. Stay safe out there.